All, this is Dr. Mobeen Sayed from Drbeen.com. Welcome to one more show. Today, I wanted to discuss one more drug that is rather new entry for COVID, and that drug is colchicine or colchicine. Um, this drug has shown to reduce the intensity and progress of COVID-19, number one. And number two, it has shown to reduce the deaths from related to COVID-19. And finally, something that these studies do not describe, and that is that if it is reducing the intensity and deaths, then it must be reducing the long haul symptoms or outcome as well. Remember that out of everyone who is infected, at least 30% or more of the patients do become long haulers. So I want to make sure that we can talk about this. So I know that today is the open forum day. However, with your permission, I'm going to move it to tomorrow, and I wanted to discuss colchicine today. Now, colchicine, we would talk in two separate parts. One part is the studies. That is what we'll do today. And tomorrow we'll do open forum. Day after, that is on Monday, we will talk about the mechanism of action of colchicine as well. So I hope I'm pronouncing it correctly. If not, my apologies. Let's start. And I hope it is okay that I'm moving the open forum to tomorrow. I think it is important for us to look at the studies with colchicine. Another important thing with the colchicine is that this is a drug that can be given in outpatient, just like bamlanivimab, and it can help a patient stay away from the hospital and stay away from becoming a long hauler. So let's start. So Barbara, how are you? Margaret, I can see Margaret. So here she is. Good evening, Dr. Bean, sir from Maine. Hello to all. Cool Beans, hello all. So I hope it is okay. With your permission, I'm going to start discussion with colchicine. I'm going to try to keep it small. And then tomorrow we'll talk about we'll do open forum. And I hope everyone is doing great. So first, I wanted to share with you. So yesterday, I launched this a video. It is 6 minutes ivermectin video that I placed on my personal YouTube channel. The benefit of doing this is not really to have medicine there, but remember I told you I had posted a post on my current channel, and there were people who were not happy about it, and I had to take it down because this channel, the current channel that I'm talking with you right now, is associated with Dr. Bean, and folks have actually been upset with Dr. Bean. There have been audits that are still going on. I do not know what is the outcome of the audit. So there is a bunch of risk that is generated when I speak more freely, because people they complain not only to YouTube but to our associated agencies as well. So what I'm doing is I'm trying to go into an area which is just my responsibility. So if somebody is upset, that is just with me and not to my business. So this is why I did this. And here is the fun thing. Within one day, so I had 2 subscribers here because I never actually used this channel. I had 2 subscribers, and within one day we have 76 subscribers. Big deal for me to get 76 on a new channel. And then on top of this, within one day, there are 1,100 views. Once again, these are tiny numbers. You might say that, hey, this is nothing to brag about. But for me, it is a big deal that there are 1,100 views within about 20 hours. So thank you very much for this. I had tweeted out about this channel and this video. I am pretty excited about it that I actually created this thumbnail as well, where I'm posing and saying, hey, what is ivermectin? So you can actually see small smile on my face that I was acting and I was smiling as well. Okay, let's start colchicine. So here are a few studies. This is drbeen.com. This is the Twitter thread with the colchicine. This is the first time I got 181 likes and 92 retweets. I don't usually get that many likes and retweets. So here is the mechanism of action of the colchicine. We'll talk about this on Monday. This is one study that I would discuss today. This study is done on a smaller number of people. I believe it was, so this is a larger study, 4,488. We'll talk about this today as well. And this is a smaller number of patients, 75 patients. We'll talk about this study as well. So we'll look at the studies. Let's start. So colchicine and COVID. Colchicine is a drug. It is not. It is sort of anti-inflammatory drug, but it is not placed in the groups of NSAIDs or steroids. And let me explain what is its mechanism. What happens is this, and it's a beautiful thing, and we'll see this in more detail on Monday. But let's say this is a cell. Inside the cell, there are many things that are happening. There are many functions that are happening. And what happens is, imagine there is something here, point A, and that something has to reach here, point B. There is no way for this substance to move within the cell from A to B. It is just like this, that I am sitting here in Cupertino, California, and if I had to go to Boston, Massachusetts, I cannot just stand up and start walking. I can, but probably I would not reach there in very decent time. Instead, I need a vehicle, and I need some sort of road, or I need a vehicle and air travel. So here inside the cells, when things have to move, we build roads, which are called microtubules, small tunnels, small pipes. These roads are laid out. Then there are machineries or enzymes that walk on top of these roads, just like cars going on the roads, and they haul the substances that need to go from one place to another place. Once a substance has moved from one place to another place, then that microtubule or that road is dismantled. This is the mechanism that is happening in every single cell of ours all the time. And if a cell has to move, excuse me, imagine if this is a neutrophil and it has to move from here to here. What it needs to do is it needs to create a pseudopod. It needs to create a small projection that it would use to move in this direction. Even these projections are created by making new microtubules in this area, and by removing the microtubules from the other parts of the cell. Imagine that inside the cell, a roadwork, a network is being made and dismantled all the time. This is also important that when a cell needs to divide, so let's say we have a cell, it's a cell in GIT, or it is a neutrophil, or it is a macrophage, or it is a other blood cell, red blood cell. When it needs to divide, when the new cells are being formed, and please know that new cells are being formed in our GIT, in our skin, and in our bone marrow all the time. So when a new cell is formed, what we do is we create a spindle inside the cell. And on that spindle, we divide our DNA and stick that DNA on it. These spindles are actually roadworks. These are roads. And what they'll do is they'll take a copy of one DNA on one side, and the other DNA copy would go to the other side. Then the cell will pinch in the middle and slowly divide into two daughter cells. So for this process, it is really important for us to create this spindle-like road network. And that network is also made up of microtubules. Cilia, when they move in our cells, for example, bronchial epithelium, these are microtubules. When a sperm moves from one place to another, it is microtubular structures that are moving in it. So we have microtubular function going on in our cells all the time. And colchicine is going to disrupt this microtubular function. And now you can see actually that this drug, if given in more dose, can actually cause bad outcomes, because it is going to reduce the division of new cells. and making of the new cells. So in this way, it actually reduces the inflammation, which is useful for example, gout. But if you give it in too much of a quantity, then it can actually reduce the division of cells in GIT and cause GIT problems, or the skin and cause skin problems, and so on. So it is a drug with very narrow safety margin, and because of that, it has to be used very carefully, but it is used. Now, with this high level mechanism of action, let's see what it is and how it is used in COVID. So colchicine has been used in gout. Since 6th century, we find it in literature that the plant that contains colchicine has been used for joint pains. So it is not a new drug. It has been out there for hundreds of years. It is also used in pericarditis for inflammation. It is also used for coronary artery disease as well, and many other. Now, it is a second line therapy for gout. The reason for it to be second line is that it has a very narrow window of or margin of efficacy. If you give it in lower dose, it doesn't work very well. If you give it in higher dose, it doesn't work very well. So because of that, it is second line. Now, it has higher rate of side effects, and the reason for that is that it causes the cells it disables them or reduces their divisions, especially at high doses. Now, what are the kind of functions it performs? Number one, it is antimitotic. That is what I just described, that it would kind of reduce the division of a cell. Then it helps with it reduces the depolymerization of microtubules. So polymerization means formation of microtubules. Depolymerization means breakdown of microtubules. It actually, so I spoke it wrong, it actually promotes the depolymerization of microtubules. It breaks down the microtubules. What does that mean? It breaks down the roadways in our cell. So cells function and division goes down. So to an extent, it is useful. We have found the therapeutic range where it can actually be beneficial and its side effects or harmful effects are less. However, given in more dose can be harmful. Now, what does it do by breaking down the microtubules? Number one, neutrophil recruitment and motility. Please remember, whenever we talk about any immune cell that needs to walk, that needs to go from place A to place B where the infection is, that cell will need microtubular structure to keep becoming built up and torn down and built up, and that is how it walks. So imagine if we humans are in a bag. So imagine if we have a cloth bag around us, and then we are walking inside that bag by using our legs and hands and whatever. It is the same thing over here. The cells have their legs and hands, millions of them, inside the bag, inside the cell membrane. They don't have their legs outside. And so inside they walk by making and breaking the microtubules, and that is how the cells move. Isn't that fascinating? It's beautiful. So the neutrophil recruitment means neutrophil, which is part of the innate arm, going to the site of infection. Motility means movement. Similarly, cytokine production, chemokine production is reduced by colchicine as well. How does that happen? Look, when colchicine reduces the formation of microtubules, then these substances, chemical substances moving from point A to point B inside the cell to go make some, let's say, cytokines, and then to release those cytokines at the surface of the cell, all that needs things to move. And when microtubules are not being built correctly, or if they are built, they are broken down, then the cellular secretions reduce as well. Imagine that reducing cytokine storm. Why? Because number one, chemotactic recruitment motility of the innate arm is less, so the cells to the site of infection are less, number one. Number two, they are releasing less cytokines, especially interleukin 1b and or 1 beta and interleukin 18, which in turn help reduce cytokine storm and help reduce recruitment of more immune system cells. Beautiful mechanism. Do you see that how drugs have various kinds of mechanisms? We know that we have tocilizumab that reduces the production of IL-6. And we know that we have, for example, steroids that reduce the production of almost all interferons and all cytokines and reduce inflammation. Here we are looking at a drug that very uniquely reduces some chemotaxis, that is movement of cells, and reduces the secretion by breaking down the roadways infrastructure of the cell. Beautiful. Then, if Debbie Boss was here, I would have discussed this with her as well. So mast cell degranulation. Remember that we talked about it, and Debbie was, she wanted to talk about the mast cell activation syndrome that may be behind the long hauling syndrome. Mast cells release histamine, and colchicine specially reduces the histamine release from mast cell as well. That means colchicine can be actually useful if mast cells are the problem. Then colchicine can be useful for long haulers as well. Beautiful drug. I love this drug. Then it reduces the insulin secretion. So it may actually modulate the diabetes. Insulin secretion for pancreatic cells. So remember, all cell functions would go down a little bit, some more and some less. Then melanin movement in melanin cells, that is reduced too. We are more concerned with this part and this part. Why? Anti-mitotic means less cell production, less new immune cell production, anti-recruitment, anti-motility, anti-substances, all of that means less cytokine storm. So now let's look at the studies. Beautiful thing. This is a good drug. Now this is this study, this one. In this study, they had about 4,488 patients. I have the study open here as well. This study is done in Quebec. This study was supported by, I believe, some organizations in Quebec and Bill and Melinda Gates as well. So please don't turn away right away that if you feel that, hey, Bill and Melinda Gates are going to do something wrong here. This is actually a decent study. So let's look at the study itself. Here is what they did. They took 4,488 patients, outpatient. Their rationale for this study was, we know that when somebody becomes hospitalized, then at that time, we can give them dexamethasone or we can give them tocilizumab. But how about people who are in outpatient? Can we give them some drug that would help them not go to a hospital, not become a long hauler? And I'm just very quickly going to see if everything is here. I'm so used to doing interaction on Fridays that I am, okay, so everything is good here, right? Also, Denise. So Denise, you had talked about the MCAS as well, and Debbie had talked about it as well. So Debbie Boss had talked about it too. So Denise, and so we'll talk about this. So Denise, I hope that you heard that too. We'll talk more on Monday as well. Okay. Correct. This is very correct. Ruby's Red is saying that it can cause severe dehydration. So guys, please remember that any drug that would affect the cell division, that drug would reduce production of immune cells because immune cells are always being generated. That drug would reduce the patency of the GIT. Our GIT surfaces, our gastrointestinal tract surfaces, these cells are being replenished all the time. They are thrown out all the time and they are made new all the time. So if there is something that is going to cause a hindrance with formation of the new cells, then there would be GIT symptoms. This is why patients who are on chemotherapy, they cancer chemotherapy, they get GIT effects because their GIT cells are not producing in the correct way and correct number. Similarly, these patients can have skin issues as well, because skin is also generated continuously. So here, in case of colchicine, mostly the side effects are on the GIT before they are on the skin, and the side effects on the immune system in therapeutic doses are actually the effects that we want. Okay, so continuing. This study here, March 2020 to December 2020, it is a randomized double-blind outpatient study. People included in this were 4,488. And here is what they did. To half of them, they gave 0.5 milligram colchicine twice daily for 3 days. Then they gave 0.5 milligram once daily for another, let's say, 27 days, a total of 30 days of therapy. On the other hand, in placebo, that was a placebo. And we'll talk again on Monday about the pharmacodynamics of colchicine. Colchicine can actually accumulate in the body, so it should not be taken outside of therapeutic doses and frequency. Secondly, colchicine can actually accumulate in the patient with liver disease or liver failure and renal failure. So it has to be very, very carefully administered, and doses changed in patients with renal or liver issues. All right, so continuing, here is the rationale that they had for the study. They wanted to say that, hey, cytokine storm is something we need to block. We know that IL-6 production can be blocked in hospital by tocilizumab. They knew that dexamethasone can be given, but what should we do in outpatient? So that is where they said, let's try colchicine. The primary endpoint was that will the patients still need hospitalization, or will they die? And will this drug reduce the hospitalization and death? That was what they were looking for. So let's look at their results. So the results there were 2,234 patients in the ones that received the therapy, and 2,235 that were on placebo. And here is what they saw. Hospitalization and death. Total out of these 2,235 in colchicine group, 104 people, or 4.7%. Hospitalization and death in the placebo group, 131 people, or 5.8%. So odds ratio was 0.79. However, if you look at their confidence interval, it crossed the unity. So from 0.61 to 1.03. If it had stayed below 1, it's almost above 1, then it would have been significant. So it crossed the boundary there. P was fine. P was 0.08, but their CI kind of crossed. So this is why in their study, you would say they will not say that the reduction in hospitalization and death was significant. They would say it reduced the hospitalizations and death. Now, individually, death, there were 5 deaths in colchicine group versus 9 deaths, almost double, in non-colchicine or placebo group. And remember, this was a 1-to-1 trial. So 0.2% deaths in the colchicine group and 0.4% deaths in non-colchicine or placebo. So in my opinion, that is a pretty good thing. Hospitalization. In colchicine, 101 people needed hospitalization, or 4.5%. 4.5%. Normally it is more. So, but here, if you see, the placebo group was 5.7%. Adverse events, 4.9% in colchicine and 6.3% in placebo. So you may not be hearing from me statistically significant, because most of these results were not statistically significant, just like this one. So the result was that they said, hey, this drug actually, let me go to this one. If you go to their results, or let's just read their conclusion. Among non-hospitalized patients with COVID-19, Colchicine reduces the composite rate of death or hospitalization. So that is how they said it. It reduces it, but it is not clinically significant. Although the numbers were tiny bit above, not too much. Still, from a statistics point of view, it is not significant. From a trend point of view, there was a lot of benefit. Side effects. The most important side effect was GIT. That occurred in about more than in about 20% of the patients who were receiving colchicine. And conclusion was that death and hospitalization is reduced. Now, second study, that is this study. So beneficial effect. This is a smaller study. The patient count here is 75. I believe that 72 patients actually went on with the trial. So 36 in one group and 36 in the other. So let's look at this study. So 75 total, but 72 that went through this one to one. So what was the therapy? 0.5 milligram of colchicine thrice daily for 5 days, then 0.5 milligram of colchicine twice daily for 5 days. So total 10 days. Previous study used it for 30 days. And then there was a placebo. The endpoints, what they were looking for was, would there be hospitalization, need for hospitalization, need for oxygen, need to enter an ICU, and death. So let's look at the results. I think you would like this one. Oxygen need. So 4 days. So this was days that patients, how long will they need oxygen? So in colchicine group, patients needed 4 days on average. In placebo, they needed 6.5 days. The range for colchicine was 2 to 6 days for oxygen need, 4 to 9 days for placebo. And if you see here, this was significant. So that means the anti-inflammatory action, that means the neutrophil suppressing action, that means the cytokine reduction by colchicine was actually very useful. Hospitalizations, 7 days of hospitalization, anywhere from 5 days to 9 days. And here in the placebo, 9 days hospitalization from 7 days to 12 days. And again, P was significant, 0.003. So it helped with that as well. Oxygen need in colchicine group, overall 67% on the second day, 67% patients needed oxygen. In the placebo on second day, 86% needed oxygen. And here is the important point. On day 9, in colchicine group, only 9% needed oxygen, while on day 9 in placebo, 42% needed oxygen. So that is a huge difference. That means colchicine was helping reduce the inflammation and the cytokine storm. In the colchicine group, there were 0 deaths. And in the placebo group, there were 2 deaths. Again, death has a from a study point of view, because when somebody dies, we cannot further study them. It kind of finishes the statistical improvement tracking or deterioration tracking. If a patient has not died and they continue to improve, just like here we said oxygen need 9%, then it is actually a better data collected, or oxygen need here in 42%. So this is actually great that nobody died in the colchicine group, because they were able to then continue to look at the data. Plus, colchicine was responsible to reduce the deaths to 0. Again, small study, 36 and 36 people. So one can come and object and say this is a small study, but this is a very important study to show that colchicine is very, very valuable. So this, in my opinion, is an additional drug for outpatient management, just like bamlanivimab. Colchicine should be looked at as well, and fluvoxamine should be looked at as well. That means ivermectin, fluvoxamine, colchicine, these are very decent drugs to keep in mind when treating people in outpatient where you feel that there may be a risk for someone to become severe. So these are the studies. So let me just very quickly show you the study here. So if you see here, this was a study, this is their results. Colchicine reduced the length of both supplemental oxygen therapy and hospitalization. The drug was safe and well tolerated. Once death was an uncommon event, it is not possible to ensure that the colchicine reduced mortality of COVID-19 because the size was small. So here we are with this one. If you're comfortable, what I would do is I will stop here so that this part of the video stays small. Then we can do some chit chat and we'll move the open forum to tomorrow. How about that? Absolutely. I am actually reading a comment and just speaking. So John says, a simple garden, this is huge. Ivermectin as an option for all patients. Ivermectin as an option for all patients and all stages of the disease. It is such a magic. Cool. So should we hang up for the time being and then do some chit chat? And my customary message, please like, subscribe, and share. And there is a link in the description for buying me a coffee, or if you wanted to become my patron, there's a link for that as well. And there is a link for supporting my work in general too. So thank you very much, and I would see you in a few seconds.